Tapa mo afio ato mafio tau loto Tongan. Tapu pa mo e hau e o tu Tonga. Hufanga atu e talamalo e lotu. Ka mai talamalo e whonua. Mga iha katoa peu whawhakatapua. It is very important for me as a Tongan to acknowledge our spiritual world, our leader, the King of Tonga, the many ranks and levels in our society and also in this gathering. But more importantly is to ask permission for me to share my story. My story starts in the island of Tongatapu, where I grew up. Then my grandmother took us to where my father is from, which is the island of Vava'u at the far north. As we arrived, our family were so happy to see us. They have lots of food. We sit down and then share talanoa, talking. We talk about our families. They talk about important places in Vava'u that links to our family. And before sunset, my grandmother took us to the cemetery where my grandfather is buried. And then she introduced us to our grandfather. The way my grandmother talked to my grandfather's grave and those burial grounds where his siblings are buried, it was like she was talking to living people. And she said to them, "These are your grandchildren. I'm bringing them home." And then she looked at us and then she says, "These are your families." She also told our grandfather, "Look after our grandchildren when we're here in Vava'u." And then she keep on talking. See, talking is very important for us Tongan. The Tongan word for talking is talanoa. Talanoa captures a whole lot of ways of how we think and how we do things. Talanoa comes from two words. Tala means to tell or told, and noa is like a sense of harmony or balance or symmetrical. It also encompasses some of the worldviews in our Tongan people. A couple of things that I like to draw from. Linear versus secular, and individual versus collective. Tongan people tend to align much more with secular and collective rather than linear and individual. In this diagram that you see here with the red arrow, from point A to point B, it tells the story of a linear and individual journey. An example of that would be me at work walking to someone and saying, "My name is Sione, I'm here to give you your injection." If you do that to a Tongan person, it doesn't work like that because we don't think linear and we don't think individualism. We go in that secular manner that you could see this arrow pointing from point A to point B. If I go to a Tongan person and I say, "My name is Sione, I'm here to give you your injection," they say to me, "What's your last name?" I say, "Vaka." "Which Vaka are you from? Are you the Vaka from Tongatapu, or are you the Vaka from Ha'apai, or are you the Vaka from Vava'u?" Then I'd say, "I'm from the good-looking Vaka." "No, I'm from Vava'u." They would say, "Are you related to Tevita Vaka?" I say, "That's my uncle." Then they will talk, "I used to play rugby with Tevita. I know Tevita, he's a good man." The engagement starts from there because we're going in that secular manner. And from that onward, we start to build relationship, start to show some trust, and then we'll start to slowly move into what I'm talking about, the noa. Noa is demonstrated in the graph that you could see with the X and Y axis. See the positive and the negative. And the idea here that the noa is where these meeting points are. For example, if the head of the family says, "We're having a funeral, everybody put in like $200. Someone would probably say, "That's a really good idea, come from the positive sides." And someone says, "That's a really bad idea," and come from the negative side. And in this space, people talk to each other through talanoa, and they go around in that circle. And all of a sudden, they come to a meeting point after so many discussions, and probably with a lot of laughter, and also with a lot of tears. But they will come to this meeting point, and that is the noa that I'm talking about. So, us Tongan, it's really hard to focus with the individual way of approaches. We need to know how we go around in this conversation. So it's very tricky as well. You got to know Tongan to work with them. If you ask a non-Tongan, what did you have for lunch? They'll probably say fish and chips. But for a Tongan person, what did you have for lunch? They'll talk about, my cousin Joe came pick me up. He's got a new car. We drive by, pick up his brother. Then we roam around at the beach. There were lots of people at the beach, and then we come and have fish and chips after a while there. So we don't go directly to the answer, but we're going around as well. And that's how we talanoa in our Tongan society. And when you're really, really good with that, you got to know what the Tongan hides in terms of how they talk. Like sometimes they tell you, I like your t-shirt. If a Tongan person say that to you, it's not a compliment. It means they want your t-shirt. But that's another different story. But coming back to the importance of circular and collective in terms of working with our Tongan society. And with this talanoa, how important it is in how we move in that circular manner. As I move into health, I see different interpretations of health. And I learn about those non-Tongan way of looking at health, absence of disease, symptoms free, to be healthy. And through research, it reminds me when I keep talking to our Tongan people that to be healthy in our Tongan society is more than that. It's about connecting with your social world, connecting with your spiritual world, connecting with the environment, and make sure that you are keeping and maintaining those relationships. That is what's much more important for us as Tongan. Then I remember how my grandmother took me when I was young to the cemetery. It is very important that she took us there because she wants us to maintain those relationships with our people that have passed on. Very important as well for us to go to Vava'o because that's the environment where my father grew up. So for her, it was important that she has to reconnect us with all those important things in life. And that's why I think it is quite important that we need to revisit all this knowledge and how we practice things so that we could bring it back to our current health system. And with that, I'd like to focus on health and sickness from a Tongan perspective. See, the Tongan word for sickness is puke. And if you think about the movement that I'm talking about before, how we keep moving from social, spiritual, our environment, and all of a sudden, we come to a stop. The other meaning of puke is hold. So when someone holds you, you're not moving, you're stopping, which is another translation, which is similar to what sickness means as well. And the process of healing in our Tongan languages, it involves different phases. It involves tofoto'o, whaito'o, and tukuto'o. The main word here is to'o, which is about removing. So tofoto'o is about the initial engagement consultation. Whaito'o is about the actual process of operation or trying to address what the issue is. And then tukuto'o is about coming towards the end stage, working through discharge. And once we're able to remove what's holding that person, and that person will be able to move again and able to do what they do, continuing to fulfill their social obligation, continuing to fulfill their whatever role that they're trying to do in their community. So I think it is very important that we need to revisit this Tongan way of practices and concepts and way of thinking about health, so we'll be able to incorporate it in our current way of doing things. And that is why we come to the idea about Uloa. Uloa is another framework. It's a tool that we use in Tonga. Uloa, it's a fishing style that we have in Tonga. It's a communal way of fishing where everybody in the community participate. It's either the village, the church, or people who live in a society. So this idea, they need to work together. But the Uloa, it involves the whole village, the weak, the young, all gender, all ages. So whoever's in the village, they have a role to participate here. And what involves in the Uloa is people have coconut leaves that they prepare like a net, and on the day of the Uloa, they all meet down at the beach and they move and collect the fish together, but they have to hold on to one another, and they move in a timely manner and make sure that they all come together and meet at the meeting point so that they drag the fish together. But the idea about Uloa is everybody communicate to each other as they move in this movement. No one is left behind. They all talk to each other. Whenever there's a weak spot, they put their energy there and they move along with them as well. And they ensure no one is left behind. They all move together to the meeting point. And that's why I think it's really important to bring Uloa and inform our current mental health services. Our mental health services at the moment, we have very high Pacific people and Tongan people in mental health services. But the idea about Uloa, if we have the hospital system talking to the traditional healer, talking to the non-government organization, talking to our community, to our church, to our family, and we hold hands together like how we move in the Uloa, then we talanoa to each other, we engage those trusts, and get people to be on the same boat and don't leave anyone behind. We can move together and address mental health. The other thing about Uloa as well is we'll be able to hold hands and weave our knowledges together. The biomedical ways of interpreting health, the Tongan way of interpreting health. There are intersections in many, many levels, and we need to incorporate these ideas together. And once we move together with that, we'll be able to address mental health for our Tongan people. Uloa is circular, collective, inclusive. They have talanoa, and Tongan worldviews are captured there as well. It also involves in a perfect day, which the word lagi explains good health for us Tongan. This means when there's clear blue sky and also the environment is beautiful and everything is beautiful, harmony, balance and everything there. So to have good health in a very good day, that's a good day for the Uloa. It is important to note as well that Uloa is not only for Tongan people, it's practiced throughout the Pacific. In Fiji, they call it Yavirau. Samoa, they call it Lauloa. And also in Hawaii, they call it Hukilau. So it's a fishing style that has been through the Pacific, through ages in our tradition as well. And we need to bring it back so that and inform our health system about how we do things. I think it's far too long that we have been trying to measure Pacific health issues, Tongan health issues with non-Tongan tool. Not only that, we're trying to force non-Tongan solutions to treat Tongan problems. It is about time to look within our Tongan society, see what has been working for them and incorporate them to health so that we'll be able to improve the mental health of our people. Malo apito.